Heat stroke warning signs. The day began like any other summer Saturday. Jasmine loaded her Labrador retriever, Cooper, into the truck and drove to a local park. The temperature was already climbing, but Cooper seemed excited. His tail wagged constantly. He chased tennis balls. He splashed through shallow water. Everything appeared normal. After an hour of activity, Jasmine noticed Cooper slowing down. She assumed the dog was simply tired. The panting became heavier, then heavier still. Cooper stopped chasing the ball. He sought shade beneath a nearby tree. His tongue hung unusually far from his mouth. Thick ropes of saliva dripped onto grass. Within minutes, his back legs appeared weak. When Cooper stumbled, Jasmine realized something was seriously wrong. By the time they reached the emergency veterinary hospital, Cooper's body temperature had risen to dangerous levels. His organs were beginning to fail. Cooper was experiencing heat stroke. Every year, thousands of dogs develop heat-related illnesses. Many cases are preventable. Some occur during exercise. Others occur in parked vehicles. Many happen simply because owners underestimate how quickly a dog's body can overheat. Unlike humans, dogs have limited ability to cool themselves. Once body temperature rises beyond a critical point, a medical emergency develops. Without immediate intervention, heat stroke can become fatal. Heat stroke symptoms often develop rapidly. Early signs may include excessive panting, heavy drooling, restlessness, seeking shade, bright red gums, increased thirst, fatigue, reduced willingness to exercise. As body temperature rises further, more severe symptoms may appear: weakness, vomiting, diarrhea, disorientation, difficulty walking, collapse, seizures, loss of consciousness, shock, organ failure. In severe cases, death may occur despite treatment. What it is: heat stroke occurs when a dog's body temperature rises beyond its ability to cool itself. Unlike humans, dogs possess very few sweat glands. Humans regulate temperature primarily through sweating. Dogs rely mostly on panting. Panting allows moisture to evaporate from the respiratory tract, helping dissipate heat. When environmental temperatures become excessive or heat production exceeds cooling capacity, body temperature begins rising rapidly. Once internal temperature reaches dangerous levels, normal cellular function becomes disrupted. The effects can be devastating. Heat stroke may damage the brain, the heart, the kidneys, the liver, the lungs, the digestive system, the blood clotting system. As temperature rises, multiple organ systems may begin failing simultaneously. This is why heat stroke is considered a true medical emergency. Which dogs are most at risk? Although any dog can develop heat stroke, some face a significantly higher risk. These include brachycephalic breeds. Dogs with short noses and flat faces often struggle to cool themselves efficiently. Examples include bulldogs, pugs, Boston Terriers, French bulldogs, boxers, overweight dogs. Excess body fat reduces the body's ability to dissipate heat. Senior dogs. Older dogs may have reduced cardiovascular and respiratory efficiency. Puppies. Young animals have less effective temperature regulation systems. Dogs with underlying medical conditions. Risk increases with heart disease, respiratory disease, neurological disorders, obesity. Common causes of heat stroke. Many owners assume heat stroke only occurs when temperatures are extremely high. In reality, several situations can create dangerous conditions. Common causes include exercise during hot weather. Running, hiking, agility training, and vigorous play may generate dangerous levels of body heat. Hot vehicles. Even with partially open windows, vehicle temperatures can rise rapidly. Within minutes, interior temperatures may become life-threatening. Poor ventilation. Kennels, garages, sheds, and enclosed spaces may trap heat. High humidity. Humidity reduces the effectiveness of panting and makes cooling more difficult. Lack of access to water. Dehydration significantly increases risk. First steps. If you suspect heat stroke. Step 1. Move the dog immediately to a cool, shaded environment. Step 2. Contact a veterinarian or emergency veterinary hospital immediately. Step 3. Begin active cooling. Use cool, not ice cold, water on the body. Focus on abdomen, groin, paw pads, neck. Step 4. Use fans when available to improve evaporation. Step 5. Transport the dog for veterinary evaluation, even if improvement occurs. Do not place the dog in an ice bath. Delay veterinary care. Assume recovery is complete once the dog appears better. Force large amounts of water. Heat-related damage may continue developing even after body temperature begins decreasing. What the vet will do. Veterinary treatment focuses on stabilizing the patient and preventing organ damage. Upon arrival, your veterinarian may perform temperature assessment, cardiovascular evaluation, blood testing, blood pressure monitoring, electrolyte assessment, coagulation testing. Treatment may include intravenous fluids, oxygen therapy, controlled cooling, organ-supportive medications, monitoring for clotting disorders, intensive care hospitalization. Some dogs require several days of hospitalization. Recovery and long-term outlook. Recovery depends on severity and duration of overheating and how quickly treatment begins. Dogs treated early often recover fully, while severe cases may cause permanent organ, neurological, kidney, or blood clotting damage. Early intervention offers the best chance of survival. Prevention and key takeaway. Heat stroke is among the most preventable veterinary emergencies. Protect your dog by providing constant access to fresh water, exercising during cooler parts of the day, avoiding excessive activity during hot weather, providing shade, monitoring high-risk breeds carefully, never leaving a dog unattended in a vehicle. Even on mild days, vehicle temperatures can become deadly. Key takeaway. If your dog develops excessive panting, heavy drooling, weakness, collapse, or neurological signs during hot weather or exercise, treat the situation as an emergency. Move the dog to a cool environment. Begin safe cooling measures. Seek veterinary care immediately. Heat stroke can develop rapidly, but prompt recognition and treatment can save a life. If you think this video was informative, please like and subscribe and hit the notification bell. You can also share it with someone who has dogs. Thank you.